Okay, I have 10 o'clock, and we will start with the little saying here. This meeting will be in person via WebEx. Pardon me? Anyway, the public may join the meeting via WebEx in person at the meeting room or watch the live stream. If joining the meeting in person, the total number of persons, including commissioners, cannot exceed 10, and social distancing of at least 6 feet will be in effect. The governor of the state of Minnesota has issued Executive Order 20-01 declaring a peacetime emergency and coordinating Minnesota's strategy to protect Minnesotans from COVID-19. On March 24th, 2020, the Pine County Board of Commissioners declared a local emergency for Pine County. Based on these conditions, the chair of the Pine County Board of Commissioners has determined that the requirements of Minnesota Statute 13D-021 Subdivision 1 have been met, and it is not practical or prudent for all members of the county board to meet in person. The public is invited to join the meeting in person or remotely by phone, and the access codes are listed, and or you could live stream. So we will officially call the meeting to order and rise for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We'll move on to public forum. Is anybody on the call wishing to speak in public forum?
Mr. Chair?
Yes.
There's no one from the public in the room here.
Okay, thank you. And I'm not seeing anybody. Debbie, are you trying to say something?
I am not.
Okay. Okay, we will move on then to the agenda. Are there any additions or corrections to the agenda?
Mr. Chair, I do not have any additions or corrections.
Thank you. We'll move on then to approval of the minutes of the January 19th, 2021 County Board meeting and summary for publications.
Chair Helen
Yes.
will want to approve the agenda.
Yeah.
Oh, I'm sorry. We're looking for a motion to approve the agenda. Thank you, Debbie Gray.
So moved, Commissioner Ludwig.
Lovegren will second.
Thank you. Any discussion? If not, the clerk will call the roll.
District 3, Commissioner Lovegren.
Aye.
District 4, Commissioner Waldhelm. Commissioner Waldhelm. District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
Thank you.
Okay, now we'll move on to the approval of the minutes of the January 19th, 2021 County Board meeting and summary for publication.
Commissioner Moore will move that.
Lovegren will second.
Thank you. Any discussion? If not, the clerk will call the roll.
District 4, Commissioner Waldhelm. I'm going to assume that he's present until he would announce otherwise. District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lovegren.
Aye.
Thank you.
Okay, and we move on to the minutes of the boards and reports. The Pine County Chemical Health Coalition, January 2021, and the Pine County Land Surveyor monthly report for January of 21. We need a motion for that, please.
Lovegren will move.
Ludwig supports.
Thank you. Any discussion? If not, clerk will call the roll.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lovegren.
Aye.
Thank you.
Okay. We'll move on to the approval of the consent items.
Lovegren will move.
Thank you.
Moore will second.
Any discussion? If not, the clerk will call the roll.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lovegren.
Aye.
District 5, Commissioner Ludwig.
Aye.
Thank you.
All right, that brings us up to the regular agenda. Doctor, we've just got 2 items and then you'll be on, okay? Health Insurance Committee report.
We met,
Yep.
it was attached, yeah.
We need to go over it or just go with the attachment?
You want to take it? Go ahead. I'll help.
We did meet and we talked about the options that we have for our health insurance for the employees and how we've done benefits in the past by giving them to all employees and how this is going to be used for just the county employees on health insurance. And it's going to be going to the Wellness Committee, which is meeting tomorrow to decide how to go about doing this, and then it'll be coming back to the board.
Commissioner Lovegren.
The wellness. I wasn't.
Did you got one?
I said it
got
was
one
going to be coming back.
question?
Yes.
Okay. When I was reading through it and your explanation now, the Wellness Committee is gonna, everybody that works for the county can take part in any activity that the Wellness Committee decides to do with this money, right?
Probably not. This is, the difference is that this is insurance money that's from the insurance for the insurance plan. And that's part of the conversation is how do we do it so that all employees will benefit? But is that, when we only have so much that we can use for programs, is it only going to be for people with the insurance?
Well, I'll let the committee decide that because that's why we have committees. But my 2 cents worth is that the savings is seen by the whole county, and the county's budget pays for insurance. Therefore, I would hope we could figure out how we could make these wellness activities available to every employee.
Right. And I think that that's where the difference comes in, Mr. Chairman, is that that's our goal, is to do things to help benefit the whole county as a whole, because it's a benefit for everybody. But with the health insurance money that we're getting, if we do any of the programs that they have through United Healthcare, if I participate in it, then I get money put into my healthcare savings account from there, or I get benefits such as that, which can't go to every employee. So that's where some of the questions are coming up and how to handle that.
You guys will figure it out, but I think you know where I'm coming from.
Yep.
Mr. Chair.
Yep.
Commissioner Ludwig, so the way we set it up this time, and we're gonna do a 1-year thing with $18,000, and it's gonna see who jumps in and how many participate. It's kind of gonna be like a pilot project starting over, because that's what we're doing. So we'll see how many of our employees jump in, and the big thing is adjusting which program we're going to apply, because there's different layers of expense to apply to each program. And we have $18,000 to play with for the first year. So we're trying to figure out the way to get the most bang for the buck, if I could say that, and hit all the employees. So we're just starting out, and
So what we're going to do is we'll go back to the insurance committee is represented pretty much by all the departments in the county. So we'll walk back through that whole insurance committee group.
Right.
And we'll go from there. So give us a little time.
Yep, I will.
Okay.
I think you know my feelings, so.
Yes, yes. And I think we feel the same way.
Yeah, we do.
Yeah, thank you. You guys will figure it out.
And Mr. Chair, there is one action item to approve the recommendation of the committee with regard to delegating to the wellness committee and authorizing up to $18,000 if someone wants to make a motion.
I'll make that motion, Lufgren.
Thank you. Looking for a second.
Ludwig will support.
Thank you. Is any discussion? If not, the clerk will call the roll.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lufgren.
Aye.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
Thank you.
Thank you, folks. We'll move on to the Land and Zoning and Advisory Committee report. I believe you met yesterday.
Yes. You want to start it? We had a big meeting yesterday with a lot of information. And I know we're all used to it. JJ is not here. That might be new to him, but Terry is very, so we went over the tax forfeit. What is going to be, the old offerings that didn't sell, we have to, of course, do a resolution to move them so they go to the new, so they can be reoffered this year on the sale. And then we have the new ones, we went through that. So that's a kind of a standard thing that we'll approve with those resolutions. And then we had a long discussion about the division of the percentage for the blight cleanup, which we had established. We left everything the same except for the percentage that we're going to contribute to the parks and trails or whatever group that is. And we raised that from 10% to 20%. So that's the new part there. And we had an extended discussion on encroachments onto our county property. Permanent deer stands that are being built out in our memorial forests, and some are kind of like miniature cabins. And so we started working on an ordinance, trying to decide how we are going to control that. And so we're in the rough preliminary discussion on that, which will bring Reese into it when we get it, I think, a little more fine tuned. We'd like to get it going as fast as we can. It's going to take some time. And then, of course, the trying to limit how many trees you can cut when you make a trail into county land and that kind of thing. So we get hung up on some of that, but we'll get sorted through that. And we'll come back to the board at some point. And I think I hit the high stuff pretty good there, the important stuff. So if you have, go ahead, Terry, if you think there's something I missed.
Nope, I think you did it.
Okay.
Thank you.
Thank you, Mr. Chair.
Mr. Chair, I would just follow up that Commissioner Ludwig reviewed some actions that are going to come forward to the county board at the next meeting on the 16th. So you'll have the opportunity to review the land sale resolutions and the set aside of the tax forfeiture proceeds.
Thank you for the good work. I appreciate it. The fun stuff will be when we start talking about people's deer stands and stuff. And we've had discussions over the years. I know about limiting deer stands to just being portable stands if they're on county land. I don't know if we need to go that far, but I think there's some definite education that needs to take place with deer hunters.
Mr. Chair.
Yeah.
I agree, and we had that discussion, and I think we are going to go to portable only. And then give the people that have permanent stands time to remove. That was where, or have an extended discussion. And then we really would like to figure out a way to limit these people cutting, 100 and 200-foot shooting lanes, 10 feet wide and cutting down timber, because the next person that comes there might want a different experience on our public land hunting and not want to have this, look like, man, went in here and, it's not allowed. It's not, we have to have it so it works for everyone. So that's where we're really having a lot of discussion.
Yep.
So.
Thank you very much for doing that, working on that. No action needs to be taken at this point. We will move on to the Midwest Medical Examiner's Office Annual Report. Welcome, Dr. Quinn. We're looking forward to your report. I read through it.
Yeah, not a pretty report for Pine County for last year. It was not good.
Not.
Yeah, so the total cases that our office investigated or were reported to us were 225, and I'll just skip way down. Of those, we approved 189 cremations. So the interesting part is for the total autopsies, there was an increase of 17 from 2019. And so we had 39 autopsies last year, and that was the most recorded in the past 5 years. Of those, we see a significant increase in the overdose deaths or substance abuse deaths. So there were 15 in total of those in 2020 compared to only 4 in 2019. And as is typical, unfortunately, usually the majority of non-natural deaths that we investigate are males. And so there were 12 males and 3 females of those substance abuse deaths. The age range was 23 to 64 years. And then the substances, so I just listed what you'd consider illicitly used substances. And so there were 9 incidents of methamphetamine, 5 incidents of fentanyl, 1 acetylfentanyl, which is a fentanyl analog. Heroin was present in 5 decedents. And there was also 1 incident of cocaine and 1 of buprenorphine. So going back, also there were 2 homicides, whereas we hadn't had a homicide in Pine County investigated by this office anyway since 2017. And there were 2 last year. A 25-year-old man was shot by law enforcement, and a 60-year-old man was shot by another person. So going back to the natural category up top, there were 99 registered hospice patients in Pine County who passed away in 2020. Of the cases where we assumed jurisdiction, which means that our office is signing the death certificate, we performed 13 autopsies that were natural deaths, 5 women and 8 men, and the majority of those people died of heart disease. There were 3 motor vehicle fatalities, which looks like it's the fewest recorded since in the 5-year span that we have. And in one of those, there was an unfortunate incident where a couple on a motorcycle was struck from behind, and both the man and the woman died. And then there was also a 62-year-old man who was under the influence of methamphetamine who overturned his tractor. Of the other accidental deaths, 2 elderly people died when they fell and had a hip fracture. A 4-month-old infant died of co-sleeping. A 59-year-old woman died of accidental carbon monoxide toxicity, and a 90-year-old woman choked on food. For your suicide deaths, again, the fewest that we recorded in the past 5 years, 4 suicide deaths, 3 of those were male. They ranged in age from 26 to 51 years, and 3 of the 4 died due to hanging. Lastly, there was an odd incident of multiple bones found in a bag off a roadway, and of course, that could be anything. And so fortunately, we examined those and they were non-human. So it was a busy year for Pine County last year. Let's hope that 2021 is a better year overall. If anyone has any questions for me.
Anybody?
Anybody?
I've got a question. When I was reading that report and the substance abuse line came up, I expected that there would have been some alcohol death.
That's a good question. You know, I don't always include there's very rare, believe it or not, acute alcohol toxicity. If you look at under the natural categories, one person did die of complications of chronic alcoholism. And again, it is very uncommon for someone to die of acute alcohol. And I probably didn't include, or usually don't include alcohol unless there's something really remarkable. But yeah, alcohol is pervasive, and we see lots of chronic alcoholics. I had someone in their 20s, you know, people in their 20s die of chronic alcoholism. So yes, no, alcohol is probably one of the worst drugs that we deal with, honestly. But generally, when it's an accidental death due to acute toxicity, it's one of these illicit drugs, generally not alcohol. Alcohol is more of a chronic actor, or someone's driving and you know, crashes their car, kind of a thing.
The other thing that was interesting to me is the age of the people that overdosed on meth and stuff. It's like, I would have expected that to be kids almost, and they're adults.
A lot of methamphetamine users, when they die, are usually in their 40s and 50s. They've had heart disease from it. Maybe they've been using it for a long time. The oldest person, I think it was last year, who we found to be under the influence of methamphetamine, she was in her 80s.
Really?
Yes.
Wow.
Yes.
I remember that.
Yes. And so we always ask, you know, you hope you don't offend families, but we always ask, you know, is, you know, any history of substance abuse? And we don't stop asking that question just because someone's in their 70s or 80s, because they can certainly still be using.
Interesting.
Yes.
Interesting.
Yes.
Well, our committee on drugs has their work cut out for them. That number seems to be astonishingly high to me.
It was very high for Pine. A few of our other counties had increased overdoses as well. So it's certainly not just limited to Pine.
Well, thank you very much. Anybody else have comments or questions for Dr. Quinn? We appreciate the work you do for us. Your office has been very easy to work with, and we just so much appreciate you coming and giving this report every year. Thank you.
Thank you. Yeah, it's good to see you all, most of all of you. So, okay, 5 of you. But anyway, take care, everyone, and hopefully I will physically see you next year.
I hope so. Thank
all
you.
right, take care. Bye-bye.
Yeah. Okay, we'll move on to Health and Human Services, waivered services. Patrick and Samantha.
Thank you, Mr. Chair. PowerPoint should be up. We're on its way. Let me know when we're good, Ryan. Okay. All right, Mr. Chair, Commissioners, Pat Meacham from Health and Human Services. I supervise the Adult and Disability Unit. With me today as one of the case managers, I supervise Samantha Mazer. And I'm going to talk a little bit about what we do. I think this is maybe the 3rd or 4th time I've come the last couple of years, just kind of giving updates on what we do and trying to give that high level overview each year. This year, it's gonna be high level, hopefully quick, but want to go through some of the programs that I supervise, that we work with in my unit. Highlight some of the budgets that are actually managed external of the county budget, which I included some of that in the packet information. A review of some of the common services that people utilize from their waivers, from their Medicaid waivers. some of the revenues that we recapture in the unit. And then Sam is going to talk a little bit more about a success story and that personal level of what we do. So this first slide, I want more so for effect of all the different programs that we work with in my unit with the 15 individuals that I supervise. Almost all of them have some sort of funding coming from the state or the federal government, and a few of the programs do have some kind of county cost share also. But I wanted to, the ones that are bolded there, the developmental disabilities waiver and the CADI waiver. I also could have included the CAC waiver right below it and the BI waiver. Those are the ones that I'm going to highlight today, that Sam and I are going to highlight. And I'm not going to go into the acronyms and give too much of a definition, but when I'm talking about the CADI waiver, think of it as an individual qualifies for it when they have the level of need of someone in a nursing home. So they would, if they did not have the services that we provide from HHS, they would likely be in a nursing facility. So this first graph, I wanted to highlight how our numbers have increased over the last 6 years. And this is for the CADI-CAC-BI waivers. So we have worked with, in 2020, we worked with 137 individuals. You can see that's quite an increase from what we were at 2015. One of the notes when we talk about that budget that I manage external from the county, the CADI-CAC-BI budget follows the state budget calendar, so that ends on June 30th. An average caseload of one of my case managers is 60. I would say that's maybe almost outdated because Sam, I think you're almost 10% higher than that. And an important note, a difference that you'll see between the CADI waivers and the developmental disability waivers is with the CADI waivers, 56% of those people, they reside or get their services at home. That could be an apartment in a home, living with family by themselves, spouse, etc. So 56% of those people are in the community independently. The next slide here talks about that budget that I'm talking about, that external budget that we manage. You'll see on the graph, the orange bars highlight each year back to 2015 of the dollar amount in millions of dollars that is allowable, our allowable budget by the Department of Human Services. You can see from 2015 to 2020, we've doubled. Up to nearly $9 million we had allowable by DHS. And then you can see our authorized for 2020 was about 8 million. Our goal is to be within 3% of that allowable. We weren't there in 2020. So much of it depends on our numbers, the needs of the individuals, et cetera. So, and the point about those most common services that I wanted to bring up, and this data is back from 2017 when we had our last DHS audit. So 33% of the individuals on a CADI waiver utilize some type of like foster care. So when we're talking about that $8-9 million, much of that is going back into the community through these services. Some of the foster homes in our area like Accord and CLO, Provide Care. Those foster homes employ people in the community. They pay property taxes in our community. So much of that money that we're allocating to pay for those services is also coming back to us and back to the county and through the taxes. Pre-vocational services, that's phase. The individuals that utilize phase to get employment in the community or get the skills. So you can see on there the levels for just these waivers, the individuals that receive PCA. Customized living, that's the state's term for assisted living. So 13% of those people reside there. So then onto the DD waiver, or the developmental disabilities waiver. You can see here our increase over the last 6 years has been much more flat. We had quite an increase in 2020, but otherwise flat compared to the CADI-CAC-BI waivers. Up to 103 there. The reason I pointed out the other budget cycle year, the DD waiver budget follows the calendar year. So I have these two competing $8+ million budgets that we're managing also on different budget cycles. The average caseload for the DD waiver is a little bit lower. And then another big difference in the access and where these individuals reside, 58, almost 3 out of 5 individuals on a DD waiver, they're in a residential setting like a foster home. And then the piece on the spending on the budget here, like I said, a $9 million budget. This one we did, we're very close to that 3% margin that the state asks us to be at in 2020. And you can see much of that is because we tend to over authorize the dollars allowable from DHS. We see that we usually are about 10% or more under what we authorize is actually spent at the end of the year for a myriad of reasons. And in 2018 and in 2020, we actually overspent at the end of the year, and which is also encouraged by DHS. And that really I had to have a conversation with a couple people at DHS and say, hey, it's the beginning of November. We're looking like we're going to be overspending about $250,000, and they work with us to make sure we get that in there into our allocated budget. They don't want to, I think, my personal opinion is DHS would never want to hear that we're not providing services because of money. And I know the Star Tribune, I believe it was last year, had a article about all the unused Medicaid dollars for those waiver programs. So I got 2 more slides and then I'm going to turn it over to Sam briefly. This slide just has some of the by the numbers. You can see 2020, 240 individuals. My unit is doing that case management just for waivers. And again, that's 4 individuals on my staff out of the 15 are working in that. Authorized services, again, nearly doubled over the 6 years. We're authorizing $17 million worth of services in 2020. The last 2 pieces here kind of go back to what I was said right away about thinking that an individual on a CADI waiver qualifies because they're at that nursing facility level of care. One of the things we want to do is make sure these are cost-effective services. So even though looking at the average in 2020 over all our waivers is nearly $71,000 worth of services per individual, the average cost of a nursing home is another $22,000 on top of that. Now, of course, we're not just here to talk about those dollars and cents, but that is one piece of what these programs provide. This slide is a little incomplete because we haven't billed out our case management for November and December yet. The county hasn't. But I did just want to show those 2 different waivers that I think Commissioner Ludwig, it was you asked last year about the money coming back in or how we bill for the services. And it shows between the 2 different services there, the red and the orange line of our case management billing or revenue that we recapture from the state and the federal government. So that's based on our actual time spent working with an individual on their case, helping make referrals, and many of the things that Sam's going to talk about next. So the dashed lines on there are projected for 2020 because of those last 2 months that haven't been billed. DD is still projected to be down from 2019. We did have a long time retirement back in March. So we had a new staff start, and I think that's part of it. And then also, of course, dealing with the pandemic and all that involves. 2019, that dip on the top line on the CADI waivers, I did want to highlight that, is that in 2019, we had 2 staff resignations in the same calendar year that worked on the CADI waiver. And we had that position unfilled for 12 weeks, plus the training of staff, limited coverage from the other staff. So I wanted to highlight, not only for those 12 weeks did the individuals, those 60 individuals, they didn't have a full-time case manager, but also you can see how much our billing suffered over just 3 months of, And I wouldn't say that that was, I mean, for two different resignations, which is out of the ordinary, but I don't think the timeline was that out of the ordinary. But that's the impact that we face if we can't move quickly on it, so. And I'm going to turn over to Sam to talk a little bit about a success story, and then I'll come back and wrap it up, and then we'll get Commissioner Ludwig out of here by noon.
All right, I'm Samantha Mazer, and I have been at Pine County since January of last year. And so I welcomed a full caseload when I came in, and one of the individuals that I met, I just want to tell you a little bit more about. She is a lady in her mid-50s to 60s, and she has long-term chronic health issues that include pain, just a variety of things that are really going on with her health, and they continue to go on. But there's a lot of things that happened to her in the beginning of spring of 2020 on top of the pandemic that happened. So her long-term partner of 20 years passed away unexpectedly. And then she had her long-term PCA actually had to leave. And so with that, we did a lot of scrambling of how do we get supports in her home quickly and to make sure that she is safe, because there was no one to keep eyes on her on a daily basis. So not only that, but she lives in rural Pine County. And so that always causes some issues in getting staffing supports in place. So I worked a lot with different providers because there wasn't really family, or we call it informal supports, to come step up. And so a lot of things were going on. And the more I got to know her, the more kind of got known about her case. And so there was actually, we found out there was a lien on her house and a lot of unsafe things about her house going on. And all of the bills were in her significant other's name. And so those were all things that came to fruition. And so from there, I really had to think about what we were going to put in place to help her through that and to get her stable and to make sure that she could stay at home. And so what I kind of started off with was a service called Independent Living Skills. So that's a person who really can do a large gamut of things. And so it started out by, she wasn't even able to pick up her meals on a bi-weekly basis from the senior center in Pine City. And so it was just getting someone to actually go and pick those up and bring them to her. And then it transpired into, well, she wasn't actually going to appointments to get her blood draws so that she'd get her medications. And so we got that kind of squared away. So she's regularly on her meds now and not having lapse in kind of how she's taking her meds. And then it really came down to some budgeting and figuring out how to get her back on track with her budgeting and to get all the bills in her name and to figure out what was going on. And just found out recently that the lien's been taken off her home. And so she's in a much better place with that. And another thing that they were able to do is help work through some legal issues that had come up. And for the first time, she went out shopping and went out to dinner with just no other reason, or rhyme or reason. And so she was like, I gotta go to Cambridge and have a meal. And that was the first time in probably 6 years. And I was like, oh my gosh, like this is something that we a lot of times take for granted. And so just to be able to have a fun day of some small shopping and going out to eat was really huge for her. So on top of the ILS, that took quite a bit of time, and we communicate significantly, me and the ILS worker, just to make sure things are up to date. But she also got a new PCA and homemaker in there to help make sure that she is stable in her home. She finally agreed to a skilled nurse. So now not only is her appointments being taken care of so that she can stay regular on her meds, but she has a nurse to set her meds up and make sure that if she has a health issue that arises each week, she can ask the nurse about them who comes out to her home. And so that's been a really big area of improvement. And from there, I've authorized some different kind of supplies to keep her safe in the house, such as items for her bathroom and that kind of thing. And then another huge thing that we got in place once the snow started coming was chore services. So chore services, we find a provider in the community who can come snowplow and she has a long driveway, so they come and plow her driveway so that she doesn't have to worry about that. And they will come and do lawn care once the lawn season comes around too. And so all of these services got authorized in 2020. And, you know, for the first time, I'm not getting those dire phone calls that are happening, you know, 2 to 3 times a week. Like, what do I do now? Kind of that panic anxiety mode. And it's more like a monthly check-in of, hey, how are things? So that was just one success story.
The last thing I want to do is just kind of wrap that up a little bit. I was looking at the numbers on this case that Sam was talking about. So from February 7th through the end of 2020, December 31st, Sam spent over 66 hours of case management time on this one individual. And then you think about, she has another 64 individuals on her caseload, meetings, trainings, drive time, whatever it might be. So she really did put in a lot of effort on this one. It's interesting, she had those 24 contacts in 10 months. 23 of them, of course, due to the pandemic, were phone calls. One face-to-face visit, which I think was that first week of February, which was great to get that in before the pandemic since Sam was new. And then I want to, again, talk about, you know, right now, you know, estimated services, the cost per day is pretty high, $193. But I think Sam did a nice job of laying out where this individual and where some of the individuals we work with, where they are sometimes when we either meet them for the first time or when they have that health issue or that crisis, a death in the family, and we need to make sure that they're taken care of. You know, looking at ongoing, I think Sam and I were looking, you know, at probably that $140 range. And again, the reason I'm bringing up those dollars is again to bring it up, that nursing home cost of care, you know, that's $255 a day is the estimate. So what we provide can be a high number, but it's lower than what it could be. Those dollars are going back into the community, whether it could be going through Jeff's or Pine City Medical or, you know, all kinds of places in the community that money is getting put back in. But then the last piece, you know, that Sam talks so eloquently about is, you know, those intangibles, getting a lien off the home, allowing this lady to continue to live, you know, with dignity in her own home and age in place. And that's really our job, is to make sure that people can continue to live in the community. So I know that was a lot. I went over the 15 minutes that Becky wanted, but I appreciate your time, Mr. Chair, board members. And if you guys have any questions, I'd be happy to try to answer them, or feel free to route them through David or Becky, and I can get back to you at a later date too.
Well, thank you both so very much, because it's always a learning experience for me, because I don't understand what you guys do on a daily basis. So it's a good reminder. And I know from working with the Council on Aging that the big strive there is to keep people living in their home as long as they can, because it's the cheapest alternative, and most of the time gives that person the best shot at self-dignity. So we appreciate the work you do.
Thank you.
Patrick, I did have one question. Is there like an average age of the clientele that you work with, or do they go all from 20 to 90?
Well, so we consider our unit adult and disability services, but we do work with individuals on those waivers as young as 3. Yep, Sam says yes. So 3. The waivers that we talked about today, Chair, are for individuals under the age of 65. We also have another 4 staff in my unit that work on elderly waivers for individuals 65 plus. So we really have everything from 3-year-old to 100-year-olds on our caseloads.
Mr. Chair.
Well, yes, go ahead, Matt.
So I have a question. So just by knowing the aging demographic and the baby boomers, what do you expect there? What do you I know you can't, but it's going to just get busier on the age side of that.
Yeah.
And are we prepared for that or for that?
That's a great question. I know it's something that Becky and I talk about often, is making sure that, are we prepared for that? But this, I don't want to throw the state on.
I don't mean
us here, but our programs are always changing. And one of the big changes at the back end of 2021 is to the elderly waiver, and how those individuals, we have contracts with Blue Cross, Blue Shield, and with UCare to provide the elderly waivers to individuals on their insurance. And there's some big changes coming to that. We've seen an increase of individuals this month even coming from, due to the change with Fairview, coming over, switching health plans, so that now we're case managing them because of our UCare contract. I don't have a good answer for you. I mean.
So I know it's probably income based and all that. I don't want to get, but so there is going to be, we know we're going to have impact. And then
absolutely. Oh yeah. Yeah. I would, what makes it difficult is we have individuals on an elderly waiver that are on straight MA, and then individuals on the health plans that are on elderly waiver. I know our straight MA numbers have gone up significantly over the last year. And I'd have to pull the numbers and get back to you. So
thank you.
Yeah.
I know you had something to.
I did. I really appreciate the fact that you have the difference in what we're paying versus what it would be in the nursing home. It's good to have that comparison. And that was going to be the question I was going to ask you at the end, was how would you compare that? And it's, I thank you for having it all in.
Yeah.
It's very thorough. I appreciate this.
Thank you. Thank you.
It's always, I've told this story many times, and Becky's heard it many times, is, it seems like when I get advice from people, it's like about how to cut taxes, it's get rid of the damn welfare. And so it's really great to hear these stories, because they don't consider this as taking care of people in vulnerable spots as welfare, but it's truly a huge cost. But it could be a huger cost if we didn't have people like you in place.
Well, thank you, Mr. Chair.
Thank you.
Yep.
Any other comments, questions? Well, thank you again.
Yep. Yeah, thank you.
We will move on to the property tax CAMA support contracts. Kelly, you're going to take that?
Yes, thank you, Mr. Chair. So this is Kelly Schroeder, County Auditor Treasurer. And so before you today, you have kind of it's something that you've heard a lot about in the last several years with our tax and CAMA system. And so I just wanted to touch base briefly on this. So before you today, you have the maintenance and support contract for January 1st, 2021 through December 31st, 2023. It's a little bit unique because our current contract ended before now, but it's been a negotiation with our current vendor, which has been a little bit sticky considering we had originally said we were going to move to their new computer system, and then we've chosen not to, and so things have been a little bit sticky. But in the end, we have a maintenance and support contract before us today that will take us through December 31st, 2023, and that will give us time to find a new property tax and CAMA system and get it implemented, because those things take about 18 to 24 months to actually implement. Currently, we have an RFP out for the new tax and CAM system. The proposals are due the end of March, and then we'll be before you probably in the middle of May. So I just wanted to let you know we do have that going on as well besides this contract. But this contract is something that we definitely need to take us through till we can get a new system in place. Any questions on that? I guess I could have touched base too on the cost. So the cost ends up to be about $40,000 a year. That's something that's just annually budgeted. It's not something that we really have a choice to do or not, because there's always blips in the system or changes to interpretation to statute or changes to statute, things that have to be updated in the system. So it's something we have to do. And we've been able to, the last couple of years, pay for it actually out of the Recorder Compliance Fund, which has been great. Moving forward, we maybe aren't going to be able to do that. It might have to go back under the IT budget, just because that compliance fund will be kind of capped pretty dry with the new tax and CAMA system. But we're always looking for ways to use that compliance fund when we can.
Thank you, Kelly. We do need a motion on this, right?
Yes, please.
Yes,
This is Terry. I'll make that motion.
thank you.
Morrell, second.
Thank you. Is there any discussion? If not, the clerk will call the roll.
District 3, Commissioner Lundgren.
Aye.
I'm going to call for District 4, Commissioner Waldham, just to make sure that he is not present yet. Commissioner Waldham. District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes,
District 2, Commissioner Moore.
Aye.
Thank you.
okay, we will move on to the Lower St. Croix, one watershed, one plan. The implementation funding work plan, which we went over at our meeting last week with the Lower St. Croix. Now it has, because of the way that system is structured, it has to come back to each individual board that's represented and get approval before it goes back for final approval from that board. It's a clunky way, in my opinion, to do it, but it's the way that we have to do it. So, and the real strange thing to me is if somebody in one of those boards doesn't agree with it, then you got to go rewrite the work plan. Is that what I'm understanding, Caleb?
Correct.
So it's my job to convince you that this work plan is the best plan we could come up with, because we don't want to be the people that are holding up the show. But really, people like Caleb have gone through the available funds and the available staff we have and come up with a work plan. It's a small part of Pine County that's covered by this one watershed, one plan. And I believe there's about a $20,000 money set aside for work in Pine County. And I understand that some of that's already been being applied for. And the headwaters for this end of the Lower St. Croix is Rock Lake, which is just south of Pine City. So there's some work being done on the farm that surrounds much of that lake right now. Anyway, Caleb, do you have stuff you need to add?
No, you characterized it well. I guess it's about 1.2 million for the first biennium, so it's quite a bit of funding to do work for the watershed. So it's exciting. And that $20,000 is just for analysis for certain areas within Pine County, Rock Lake, and the direct drainage area to the St. Croix. So that's the purpose of that, is really just to look at the characteristics of those sub watersheds to find where would you get the most bang for your buck if you were to spend some money on assisting a farmer, for example, with feedlot improvement or drainage system, so that the any farm runoff would be treated or filtered or whatever it may be. So yeah, we've been vocal to try to get Pine County our higher ranking areas as included in the plan, and it worked. So, so yeah, we're excited. So we're just looking for an approval of the first biennium work plan and budget.
Are there any questions from anybody?
Mr. Chair, this is
Yeah.
Dave Minke. I had one question.
Yep.
In looking over all of these projects, some of them have a local match. The activity number 8, where the Rock Lake piece is, does not have any local match. And so I just want to verify or make sure everyone is confirmed that there is no Pine County money going into these projects, that it's all grant money, and that our contribution is just staff in kind.
Yes, you are correct, and that was I should have pointed that out. We have been most careful to try not to load up Pine County because we have 4 watersheds with matching dollars or administrative dollars of any sort to run these organizations.
Thank you.
So I am looking for a motion.
Commissioner Morrow, move that.
Ludwig will support.
Thank you, Commissioner. Anyway, we've got a motion by Moore, seconded by Ludwig. Is any discussion? Questions? If not, the clerk will call the roll.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lovegren.
Aye.
Thank you.
And Caleb, you will let Angie or somebody know that we approved it?
Yes, sir.
Thank you. We will move on to the scheduling of a special meeting of a committee of the whole to meet with the DNR regional director. Does that work, that July 27th date?
Yes.
Okay.
What date is that one?
David, do we need a formal motion on this, or can we just schedule it?
If you wanted to make a motion, that would just put it in the record.
Ludwig will move.
Morrow, second.
Any discussion? If not, Debbie?
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Lovegren.
Aye.
It's a Tuesday.
5, Commissioner Ludwig.
Aye.
Thank you.
Okay, we'll move on to public health update. And Sam, words that everybody my age is waiting to hear is, when can they get their vaccination?
That is the question of 2021, I think. So it's tough to say exactly when everybody's going to get it, because there's just truly so much more demand than there is availability right now of vaccines. Last week, we didn't think we were going to get any for this week. Then we got 100 to pilot going into schools and vaccinating them. So it was agreed amongst the superintendents that we would go district by district, logistically less challenging for us than picking your 20 favorite staff at this school and your 15 favorite staff at this school. We're going into Hinckley on Friday to vaccinate their staff. So they're obviously very excited. And we're really hoping that we'll get more vaccine next week to go in and continue doing other school staff. At the same time, healthcare systems are working on getting the over 65 population vaccinated. It does vary between health systems of who they're prioritizing even amongst that group. So for example, Fairview right now is saying anybody over 75 is eligible. Other systems are doing things slightly differently. We've been having frequent meetings with both Essentia and Wellia because they both serve Pine County population. So Essentia got like a pittance of vaccine this week, and most of them are going to second doses. So they have very few vaccines for anybody. And then Wellia did get 100 doses that we are hoping to turn around a clinic here later this week. It's all very tentative at this point, the logistics of it, but hopefully those 100 doses will be going to over 65 once we get that figured out. So it's really like a little bit here, a little bit there, and we're really hoping more starts to come in. The Johnson & Johnson might help. They're applying for emergency use authorization next week. That is a 1-dose series, which is lovely for all sorts of logistical reasons why 1 dose is so much better than 2. So hopefully that'll start coming in and that'll boost up our supplies a bit. But other than that, it's really a really fast turnaround when we find out we get it to when we get a clinic set up. And we just don't know until I get an email Friday at 6 o'clock at night going, oh, by the way, you're getting 100 doses next week and you have 72 hours to turn it around. So it's been interesting, but we've met that challenge, that rule of 72 hours after receipt to getting it in an arm. We have done it. So we're saying you give us more doses, we will meet that challenge. So it's been a good challenge to meet, and we've done it well, I think, so far. So we'll just keep going. Questions about vaccine?
Thank you, Sam. I know many of my friends that are older than me have very excited that they got their first dose.
Yeah, we had 200 doses. Oh, go ahead. You have a question?
I do. So they've had their first dose. How do you go about contacting them and doing the second dose and making sure that they have what they need for that?
Yep. So a couple different ways. It depends on how we got them. So if they are at a skilled nursing or assisted living or a group home, so we were working with the entity more than the individual, those people generally have paper consent, paper everything. So we just schedule with the wherever they were living, saying, hey, we're going to show up at your door in 4 weeks. Be ready for us. And that's worked really well so far. We've already gotten second doses in for our skilled nursing facilities. We're going in today to do one last catch up for anybody who had catch up first dose. So that worked really well. And then for any of the people we worked with as an individual, so an individual firefighter, an individual, dentist, whatever, they scheduled online to get their first dose. And then we just send an email to everybody who got their first dose in a particular day saying, hey, thank you for getting your first dose. Your second dose clinic is on this day. Here's a link to register. And then they just click and register for their second dose. And it's really slick and it's worked really well so far.
Okay.
We have to nudge a couple people to get in and actually register. And not everybody's super technologically savvy. So sometimes they call our hotline to help us, or we'll help them schedule over the phone if they can't figure it out. And that's worked well too. So a couple different avenues, but it's worked so far.
Okay, good. Thank you.
Thanks.
I was going to mention that last Thursday and Friday, we did have 200 doses that came our way. That was to finish out 1A healthcare workers. We had a couple left. And then we had a good number of vaccine left. So we quick said, we got to get this out the door. And we worked with our long-term care nurses, our case managers and social services to reach out to over 65 population through them, because we didn't want to open it up far and wide. We would get inundated. And we literally have that many doses to use. But we reached out to them and we got quite a number of over 65 in on Thursday and Friday, and they were very excited, and it was good to do more of that, get more doses out the door as soon as we get them in.
Mr. Chair, I got a question. What has the case load been? Has it been doing better, or has it been steady, or how's that been?
Minnesota has been doing better than most of the rest of the country at this point. We had our peak in November and December It has come down since then. It, our percent positivity has been really good. Off the top of my head, but something around 1,000, I want to say, in the state. Okay, don't quote me. Today's report was 633 in the state. So we've been really good in Pine as well over weeks, because there was a point there where it was like 100 cases a week. And I think when I updated the website, it was like last week to this week. So cases are looking good. I think people are following the rule, and people don't have a giant wedding. I think that's been helpful too. Doing good. We're not Los Angeles. We don't want to be in LA right now. They're not doing well.
Steve, you're muted.
I wonder nobody's saying anything. Anyway, we'll move on to the business and nonprofit update.
Thank you, Mr. Chair. I just have to make one parting comment on the public health side and just really drive home the point that the limiting factor on the vaccinations right now is the availability of the vaccine. That Sam and her team have the capacity to do more, except for there just isn't the vaccine available. And so hopefully the production and distribution will continue to increase. And yesterday, there was a story on Minnesota Public Radio where they had done the calculation at the current rate of vaccination and had calculated August would be when we would hit 80%. And so August seems like a long ways off at this point. So, just something to keep in mind that there's a lot of work yet to do on the vaccinations. Excuse me. So on the grant program, we have, as of yesterday, we had 50 completed applications received. The deadline is Friday, and so we're anticipating that there will be a flurry of activity as we get close to the deadline. And so just making some assumptions, we probably are going to have more grants than we have funds available. And so our plan is that we would start first with the priority 1 businesses, and those are businesses that experienced a 25% or greater loss of revenue from year to year. And so trying to target those businesses that have the biggest reduction in revenues. Next Tuesday, we are planning to meet with Don Hickman, who's managing the application process for us, and resolve any outstanding issues that there might be with ranking and prioritizing the grants. Optimistically, he thinks he may be done with the review and the ranking by the end of next week. And so conceivably, we could be cutting checks within 2 weeks of the deadline, but that is the most optimistic expectation, and it more likely would be within 3 weeks we would be able to start to cut checks. So that's the report as it stands today. Are there any questions?
Thanks. It's been a whirlwind of extra added duties. I know that, so we appreciate it. Do we have a legislative update?
Mr. Chair, we do. So the AMC Legislative Conference is February 18th. Registration for that opened today. And so if you're interested in attending that, just let Debbie know and she can get you registered. In the morning is general, it's all remote. And so in the morning are going to be some speakers and general presentations. And then in the afternoon, the various legislative committees are going to meet. A couple of legislative issues that have kind of come up that are worth sharing. we know we are very dependent upon the CPO funding, and we know that the state has not met its obligation in, I was going to say recent years, but really in most of our lifetimes in some cases, it seems. But the governor's budget proposes to cut that by 2.5% with potentially more cuts as well. And so that is going the wrong direction in the governor's proposal. And we know that his proposal is just that, a proposal. It's not law, but that is not the place where we want to start. And so hopefully legislators will come back with proposals that maintain and increase that funding. On the Health and Human Services side, you might remember it's been several years ago now when the state changed how it paid for adults at the state hospitals that no longer met the hospitalization criteria, and counties were forced to pay 100% after they no longer met the requirement. That the governor's proposal now includes children and adolescents in that.
Oh, no.
Yeah, and so that could be a significant financial increase or impact. And the issue is not that the counties don't think that the patients should not be moved out of the hospital, but it's the fact that there are not available beds with the high level of care that is necessary. And it's just like imagining you on the medical side going to the hospital for a significant procedure. Once you no longer need to be in the hospital, you still might need to be at a rehab facility or have some home care because you can't just take care of yourself. Well, many of the behavioral mental health issues are that way. They no longer need the hospitalization that the state hospitals provide, but they still need a super high level of care. And so that would be a significant cost shift versus a solution to how do you best treat those patients. So those are the two issues, two legislative issues that in my mind rose high on the governor's budget. And we will just continue to follow the legislature and see what really starts to stick. And I don't know if any of you have had conversations with others or, watch some of the legislative committee hearings or have issues that you want to put out on the table that we should be following.
David, I just had an update from the rural county people and a couple of things on their radar screen that I don't know hardly anything about, but it's for a bill that would give some money to emergency managers across the state at the county level. And then apparently there's some hearings being held by the MPCA on the Clean Vehicle Act that corn and soybean farmers are concerned about, that it would impact them. And that's about all I know about them. So anyway, there were two things on their radar screen this week. Anybody else? If not, we will move on to commissioner updates. Arrowhead County Association.
Yes, I'll take that. I went on the 20th. I'm going to jump right in with what Dave was talking about with John Ungaro's legislative update up there in the level of care thing. You remember before when I talked about the catchment dollars that were distributed to the counties around, like when Moose Lake closed, to deal with the mental ill. Well, there's a new initiative starting at the state, a bill. It's the Adult Mental Health Initiative. And they're looking at grabbing that funding, that $2 million, and starting a new program. I don't know what it is. It hasn't been defined yet. But there's a lot of talk about that, which may have impact on our funds too, because it'll be pulled out and be dealt with in a different program, which some might come back. I don't know how that's going to work. But they're targeting that lump of money. And then also in a legislative update, the the priority list that we had with, it came out of the group that Blight, the CPA, PILT, and CCA, that is, and, the sustainable approach to the PILT dollars was the third one, which I don't really, we have PILT in number 2, but that's the way it ended up coming out of Arrowhead, in the priorities. I just jumped in there, so that's enough on the legislative update, I think. But the officers were elected. Amar Bodie's the chair, Carleton County. Vice chair is Kevin Adey from Cooch, and Jeannie Storley from Cook is the treasurer. Other highlights, I highlighted at the county roundtables, I highlighted the WorkFast program from Pine County, which was interesting because that was all completely new to that group. And that wasn't, I think it was the next week it hit the papers, and people at the state were commenting on that program. But I think between what's his name, the college guy, Joe Mulford. Yeah, that Joel. Yeah, that is an amazing little program. And, as much as, training young people into that nursing, which is needed so much right now, the certified nursing, and so that generates a pretty good discussion with the group, actually. And then, of course, John also on the legislative update talked about the Department of Human Services is starting to send bills out to counties for the overpayment. So I don't know if we've seen one yet, but that might be happening. And I don't know. He suggested not to pay because it was no fault of ours in any way, shape, or form. And I think the legislative body is standing kind of on the side of counties there.
Well, it's about a $44,000 bill to Pine County. And last December, so just over a year ago at the AMC annual conference, Governor Walz stood up in front of the whole group and committed that counties would not have to bear the cost of that state mistake. And so we are not going to pay the bills, and we are maintaining our position. And we want to hold the governor accountable, and we're always hopeful that will be successful at the end.
Yes. They have a 15 billion to be budget down there. They can find that scratch much easier than we can. Anyway, I'll leave it at that, Mr. Chair.
Okay.
If anybody has any questions, try to answer them.
Thank you. Snake River Watershed Board.
Yeah, we did have a meeting. We had our management board meeting. We just paid a few bills. We had some insurance and some audit stuff we had to do. And then we had our policy committee for the One Watershed, One Plan. Was a separate meeting, separate people. Just talking about planning going forward, getting everything heading in the direction of getting a plan together and getting it sent out. So it was a pretty good meeting. One of the things that is going to come up in our next watershed management board meeting is what we're going to do with that board once One Watershed, One Plan comes on board. And just as I was reading it, I think we just approved 2 audits at $2,000 and insurance at $1,500 or $1,200, something like that. All stuff that by keeping the management board is kind of there's a lot of stuff you got to do just to keep that board alive, and it's all stuff that we're going to achieve with One Watershed, One Plan. So I'm going to push very hard to just combine that. However, we got to do it into the One Watershed, One Plan. We're going to keep it alive for now because we can implement stuff because it's on the ground. We can implement some money if there's projects that are needed right now. So, but some of the other agencies aren't so keen on that going away, and not that it'll go away. It'll just be part of One Watershed, One Plan. So I don't think it's smart to have 2 organizations achieving the same thing, So, but that's for me, and I'll probably get a lot of heck for it, but we'll see what happens.
Well, thanks, Josh, and I think you've got support of the Pine County Board for what you're talking. We've talked about that previously, and I'm not sure why some of the other boards don't think the same, but anyway.
Yep.
Mr. Chair?
Yes.
If I could just follow that up, because I know you're referencing previously, I can't recall if the board took a consensus position or if you took a formal vote. But I remember going to a Snake River meeting a couple of years ago when the One Watershed, One Plan was just rolling out, and Pine County advocated very strongly that the Snake River Water Management Board should go away once the One Watershed, One Plan is in place, because it was just duplicative. And I'm trying to recall, Josh, and I'm sure your memory is better than mine, but one county, maybe it was Mille Lacs, was supportive, but most of the members were non-committal or opposed at that time.
I think we had 3 options is what it was. And I didn't make that meeting. You and I think Steve.
I was there. Yep.
Yeah.
Oh, okay.
Yep.
And, but I think we did have one other county that's seen it kind of the way we did. In the other 2 counties seen it opposite, not together, but 2 different ways. So, and I believe actually, Reese, were you involved with drawing up some stuff to, I can't remember if that was the One Watershed, One Plan or part of how we were gonna figure out how to, the Snake River Watershed Management Board. But I think you actually drew up one of the contracts or one of the deals. So, and then that kind of got, I don't know if that really went anywhere or what yet, but it's interesting to say the least. So,
And I'm going to reach out to my county administrator colleagues, because I think the 2 counties that were most opposed have had turnover in their administrators since that time. So there certainly will be an education component of the history, but then maybe there's some different thinking that will prevail this time.
Okay, and I've been told numerous times, and I've talked to Jason Weineman from Bowser, is the one that's really facilitating a lot of the stuff, and he is very, very, very good. And he has expressed to anybody that if any of the board members want to reach out to him or want him to come to a meeting, I know we've had him a couple times now to explain Snake River Watershed Management Board and One Watershed, One Plan. But if we want him to come again, because we do have some new board members, or if some of our board members want to contact him, I've called him. I think he's answered the phone every time I've called him, and/or calls you right back. And/or David, if you need to reach out to him for anything, he's been great. So I've been told that, he just kept making that. I think in the last meeting I heard it a lot. He just kept saying, if anybody who needs to reach out, just contact me. So otherwise, that was about it. The next one should be the interesting one, and I think that's not till March, I think it's March. So.
Okay. Thanks, Josh. Let us know if we need to do anything as a board. So sounds like you got it under control. Lakes and Pines, it was a pretty quick meeting, but the thing that is interesting to me through this whole pandemic has been the fact that the people that are on the fringes of needing help need more help. They've gone really backwards during this pandemic, in things like help with rent, help with fuel, help with food, help with whatever. So anyway, that's kind of where we're at. And Lakes and Pines is stepping up to the plate as best they can, but they can only spend the amount of money that they have. They have no deep well to get more money from. So they do a good job of turning the money around that they have, but they're not getting any extra. So Lower St. Croix policy, we covered that pretty well already. Central Region EMS.
Yes, we met last Friday. It was, we're in a budget, so we're in the new budget biennium. And it sounds like the state's gonna do a non-competitive grant, so it'll make it a little easier for our applications. And then we, of course, we have the EMS grant and the Loxone grant, and then we have the volunteer training fund, which falls into that, funding. The Minnesota Resuscitation Consortium is gonna start sending out a survey on AEDs to counties and medical and deputies or whatever. It's just gonna hit everybody. They're hoping people take an active role because I think there's gonna be a grant coming down to replace the AEDs that are out there. So that we'll have to see how that goes. And then probably the highlight, I think, was when our medical director for our group, Dr. Mari Thomas, did a nice thing on the COVID. And the numbers she was saying, like, as of the week of January 17th, there was 88,000 doses that were done. And the Emergency Regulatory Board has authorized paramedics and certain EMTs with a level of training that when these vaccination stations start up, they can all help do the vaccines just to speed up the process. And there was like 871,000 vaccines promised, and I think 529,000 have been delivered to the state so far. And we're at this is as of week 17, January 17th, 4.8% of the population has had one dose, and 1.2% of the population has had the second dose. And the other, I think, was really fascinating to me was the way they've learned how to treat COVID. You see the deaths are falling off. And they're going to a high flow nasal cannulas and or this plastic helmet thing instead of intubating. And then, because once you intubate somebody, we all know that it's bad. The systems start to get in trouble. But what these other two systems, it's a 54% change in who ends up being intubated, the way they do it now. So they're learning as they're going all the time. Every day, she said, so they're learning. So that's kind of interesting that they're really working at a scientific level on that. And let's see. Yeah, Minnesota is doing 60,000 vaccination doses per week as of that Monday that we were there. That's a pretty good number. And I think that's it, Mr. Chair. It was pretty much just a general meeting after that.
All right. Thank you.
Oh, I do have one thing.
Yep.
If we have conversations with our legislators, a big portion of our funding has been the seatbelt, a percentage of the seatbelt violation fine. And because the population is like 95% compliant, that's the funds are drying up. And we've approached the legislative group, just hook us, use the driver inattentive statute or something like that, one of the other statutes to help fund the EMS services, because a county like ours, and I know I beat this to death, but we are a big rural county and our fire departments are our first responders and they have to be trained up, and we need these dollars to train these guys. They're just volunteers. They're not paid hospital staff. They're not, and they're always the ones that are the first on the scene and they get nothing. So, and we all depend on them. Right. I was a deputy forever and they were always there working. They go out on our imagine our snowmobile crashes and they're always out there before we even get to them working on them. They find them and they're calling us. So it's a program I think we need, and there's a lot of other rural counties that need it as bad as we do. So I know we have a good voice, and I know there's only so much money in the pot, but it's easy to get hooked onto a statute for funding if the state has the willpower to do it. So I said my piece.
Well, keep beating that drum, and we need to remember when we go to meetings where we have an opportunity to voice so it gets on our legislative platforms.
Yeah.
And so thank you, Matt.
Yep.
Well, I'm going to back up to the Lower St. Croix. I think I've mentioned this many times, but that organization is made up of county commissioners, soil and water, elected soil and water people, and representatives from lake shore districts or river districts or whatever. They're legal entities. They have taxing authorities. And so when we talked, Caleb said, you know, we're going to get $1.2 million for the lower St. Croix. That goes from southern Pine County to Stillwater. That's a huge area. Well, the Browns Creek Watershed District has a budget of more than that. So they are used to doing a lot of projects. And so they have written a letter now to this board, and it's going to be interesting to see how this all pans out, because they think they should get more of the money than counties anyway, because they can ask, I guess. So anyway, it'll be an interesting. It's an interesting mix of public entities.
Can I ask a question?
Yes.
So are you setting it up by project and not by where, you know, like, are you setting up your priorities by which project is going to happen and, you know, as it goes through the, which first come to do this one, then rank them like that?
What Caleb mentioned is what we're very most interested in is doing the projects that are going to get the most bang for the buck in the entire watershed. And if closing a manure lagoon in Pine County, if science says that is the biggest polluter in the whole system, that's where the money should be spent. If it's the runoff from a Walmart parking lot in Stillwater, I guess then we have to say that's the most important thing that we have to mitigate. Then let's spend it there. But it's by projects through science that people can point to and say, this is the most polluting thing we have in this whole watershed, and therefore that's going to get the number one priority on our list. Does that answer your question, Matt?
Yeah. Just the priority should take precedence over who wants to do a project just because it's in their spot, is what I was getting.
Yes. Yes. But I think there's going to be conflict arising because those people are used to getting what they want, and they are not elected officials. They are appointed to that watershed district and appointed to this board. So it's a different mix than we're used to dealing with. Anyway, well, it'll work. We have upcoming meetings. I do have one I'd like to see if somebody could sit in on, and that is the rural county meeting on February 8th. It conflicts with the landfill meeting I have. If somebody could it's a Zoom call or a GoToMeeting call or whatever. But it's a different group of county commissioners than we're used to dealing with. So we're all our whole board is listed as an alternate. So anybody can go and vote. So
I would like to. But I have a library meeting at that time. I'm sorry.
Yeah, that their meetings are conflicting with a lot of things we do.
Yeah, I'll be in personnel or finishing. Well, we won't be done in an hour, so.
I'll try to catch up with it when they're done, but when we're done with our landfill. But anyway, sounds good. Look at those meetings. Try to make them all. We'll see you in 2 weeks, correct? Thank you, everybody. no other business come before the board. I'll declare the meeting adjourned.
One
Thank
more
you.
question. We need a picture of palm trees.
It's cold here, Josh. Did I tell you that?
I don't feel bad.
It's like only 40. It's almost 50 now, but
Yeah. Yeah, it was kind of warm here. We were outside. We had hockey practice outside, and the ice was getting kind of tore up a little bit. So that's too bad. But it sounds like it's going to harden up this weekend for sure.
yeah, it sounds like it.
I'm stocking some batteries, so if you need a battery, call me.
It is kind. You can kind of tell the people that are not from native land. We're walking around in shorts and maybe a sweatshirt, and the natives are bundled up like they're going to the Arctic. But
yep. Hey Deb, I might just run up there right now if that's all right.
I'm ready for you.
Okay, sounds good. We'll see you.
Thank you, folks. See
Bye.
ya. Bye-bye.